Okay, so welcome. Let's start with the endocrinology key number one. The first one is thyrotoxicosis, hyperthyroidism in pregnancy. So what we do is we use propyl thiouracil preconception. So the female is trying to conceive. There we can give propyl thiouracil. The second one is in the first trimester when she gets pregnant. Okay, and then comes the postpartum. Postpartum. In between, we can give in second trimester and third trimester methimazole or carbimazole. Okay, so in second and third, we can give methimazole or carbimazole. Carbimazole. Okay, so these two drugs can be given, or propyl thiouracil can be given. So the thing is that propyl, methimazole, and carbimazole causes aplasia cutis and omphalocele in the fetus. So that's why we cannot risk to give these two drugs in preconception, first trimester, or postpartum. Okay, and the propyl thiouracil can be given. Okay, and so the function of both of them is that PTU inhibits. Change the color. Okay, so they inhibits the enzyme which is called as thyroid peroxidase. Thyroid peroxidase. Okay, they inhibit the thyroid peroxidase enzyme. What is the thyroid peroxidase function? Thyroid peroxidase basically does the oxidation. Okay, oxidation of iodine, oxidation, and then organification of iodine. Oxidation is when they get when they absorb the iodine. It is in iodide form and they change it into iodine form. Okay, organification is when they attach the tyrosine residues with iodine. Okay, and the third one is coupling reaction, when they combine the iodine together to form diiodothyronine or triiodothyronine or T3 or T4. Okay, so this is very important enzyme. So basically PTU and methimazole both inhibit the thyroid peroxidase. Okay, so when thyroid peroxidase is inhibited, so there is no further production, or there is less further production of T3 T4 hormones. Okay, so you have to remember that preconception we have to give PTU, first trimester we have to give PTU. Okay, and in second and third we have to give methimazole and carbimazole, and postpartum again we have to give PTU. That's it. And PTU also inhibits one other enzyme which is called as 5-deiodinase. Okay, 5-deiodinase. What that enzyme does is it converts the T4 into active T3. Okay, now let's read. Propyl thiouracil is a preferred preconception before pregnancy if the woman is planning to get pregnant and in the first trimester and postpartum. And then is the carbimazole. Carbimazole is preferred in second and third trimester in general when non-pregnant females. And carbimazole has a risk of aplasia cutis and omphalocele. That's why we don't give it in second and third trimester. And then comes the propyl thiouracil. It has the risk of hepatotoxicity in the mother. Both drugs can cause placenta, so use the lowest possible dose. Okay, so we cannot give we have to give it in lowest possible dose. And then radioactive iodine therapy is contraindicated during pregnancy. Okay, so you can risk the hypothyroidism in a pregnancy if you destroy the thyroid gland. If hyperthyroidism cannot be controlled by drugs, okay, then it is yes, then partial thyroidectomy can be done in second trimester. Okay, you have to do partial thyroidectomy, not full. That's it. Okay, then see, key number second will come. So what are the side effects? Side effects are that aplasia in cutis and omphalocele, along with if we talk about the PTU and other, they are all called as thioamides. So they can also called as agranulocytosis. Agranulocytosis. They basically drop the WBC count, and they are hepatotoxic, and they causes skin rash, and they can also cause aplastic anemia. Okay, that's it. Let's move on to key number two then.